what to expect before you get your total knee replacement. So you have had your surgery booked. What happens from the booking to showing up at the hospital? Welcome to Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal. I'm glad you finished that sentence because I thought you were going to say what to expect when you're expecting. And honestly, I don't think we're qualified.
We are 100% not qualified to do that video.
We'll get a guest on to talk about that one day.
Sure. And to introduce like our new kind of podcast style, we're trying something different. We're still do videos in the operating room, but sometimes we're doing it in this setting. And leave a comment. Let us know what you think. And also let us know if you've had a positive or negative experience from your booking to getting to surgery. But we're going to lay it all out for you step by step so you can be extra prepared.
You kind of sound like a DJ in this new style.
That's right. Remember Casey Kasem? Top 40.
I thought you were going to say Dr. Johnny Fever.
Dr. Johnny, yeah, a little WKRP in Cincinnati. That's our demographic, actually.
Really?
Yes, for sure.
God rest Lonnie Anderson. God rest your soul.
Yeah. So you've been on a waiting list. You might have had knee pain for a long period of time. You finally got to your surgeon's office and they gave you a surgical date. You are in their office. What is the thing that you're going to do in their office, Paul? Let's start right at the very beginning.
Okay. So, I mean, it's going to vary slightly from office to office, but in our office, one of the most important things you do is sign a consent form.
Okay.
That says you want to have the surgery.
Why do you have to do that? Why does it even matter?
The importance of the consent is that it symbolizes that you understand what's involved with the surgery, mostly in terms of the risk.
Right. So it's not even just consent, it's actually informed consent.
Right. It's an informed consent because any procedure that you undergo or any treatment that you get also has risks associated with it.
Yeah.
There's risks associated with everything. Getting on a plane, risks crossing the road. Not a lot of risk to us right now, but there's always risks. So when you have a surgical procedure, there's risks associated with it. And we've made videos and talked about the risks. Yeah. And the idea of you signing the consent is saying, yes, I understand there's risks with this procedure, and I still want to go ahead with the procedure.
Right. So not only do you understand the risk, but also you understand what the procedure is, what the potential options are, and just your surgeon is kind of giving you the layout of what's going to happen. And so as long as you know that and you agree to it, then you go to the next step.
All right. So that's the first thing, or one of the most important things is you sign the consent.
Right. So I'd say the next thing in our office is all at the same time, usually at the same visit. Our secretary will give you an information package that has a host of different information, and then she will help arrange a preoperative visit at the hospital. So let's start at the preoperative visit. What happens at the preoperative visit?
Okay, and just before with the preoperative visit, and in the office setting too, in that last visit before you're going to go see your surgeon in a few weeks or a few months for surgery, you have the opportunity to ask any questions.
Great.
Okay, that's what you want. That's when you want to ask those questions. It's better to ask your questions then. You probably will have questions right before the procedure, but you'll have more time to discuss the questions at that visit. Okay, that visit where you're signing consent, where you're filling out the paperwork, where the administrative staff is helping book the next visits, and that's your time to ask any questions about the procedure. What's the implant made of? How long is the recovery time? How long will the operation take?
And that usually, for me, is part of kind of my informed consent speech, where you kind of lay all that out. But sometimes at the end of that, I would always say, do you have any other questions? Or were there any questions that I didn't answer?
Yeah, okay. Sorry, then...
And then what I would say, though, is that at that point, once you've made the decision, I think one of two things can happen. You either get really excited because you've been waiting a long time, or you get nervous because now it's real, or sometimes both.
Yeah, that's fair.
Right, because it's a big deal. It's normal to be apprehensive. This is very, very common and typical. Don't think that it's abnormal, but you're going to experience a lot of emotion around it.
It's a spectrum of emotion.
Okay, so now you're at the front desk of your surgeon's office. They're giving you this information package, and they're talking about the preoperative visit at the hospital. What does this mean? You're at the pre-admission clinic at our hospital.
Okay, so at the hospital, you will have a visit where you will meet nurses, other healthcare workers, and possibly an anesthetist.
Yeah, likely.
So that an assessment can be made that your health is appropriate to have the surgery.
Right.
Okay. Some blood work may be done, some chest X-rays, or even the X-ray of the body part that you're going to have replaced.
Yeah.
You might have an ECG done as well. Some basic medical workup to make sure that you're in tip-top shape to have the surgical procedure.
And if for whatever reason your anesthetist felt that you weren't safe, they would do one of two things. They would either get you to see another specialist to optimize you, they would order a test to rule out a potential problem, or theoretically they would either delay or cancel your procedure if they felt that you were unsafe. And it's important to recognize that if this does happen, do not take this personally. The reason that you're being delayed or canceled is to increase your chances of having success and avoiding an adverse outcome.
That's a good point.
People
And
get mad, obviously.
they do.
Yeah.
Angry. Yeah.
Yeah.
It's a good point. And sometimes a surgeon may say, hey, you need to go see an internal medicine specialist first and get a consultation. You're like, well, I've already seen you. I've already seen a lot of doctors. I've seen my family doctors. But something in your medical history or one of your findings has indicated that you might need an extra workup. So you might go see an internal medicine specialist or a cardiologist or some other specialist to make sure that you're optimized for surgery.
It's like the medical equivalent of that height thing at the roller coasters at the amusement park where you must be this tall to ride. The medical assessment is like the must be this healthy to have surgery.
Fair enough.
Okay. So you've had your preoperative visit. At our hospital, often you'll attend a class, like an informational class that really specifically deals with the joint replacement that you're having. So a knee replacement, they'll talk to you, maybe even have patients that have already had it to share their experience, just to reduce some of the anxiety and unfamiliarity of the process to make it more comfortable for you.
Right. That's your pre-op visit at the hospital.
Okay.
You probably won't meet your surgeon at that visit, okay?
No.
So I'm not there for those pre-op visits.
No.
Brad's not there for his pre-op visits at the hospital.
No.
But it's a bunch of other people who are involved.
You already know us. You don't need to meet us there.
Yeah.
Okay, so are there any other things prior to surgery that need to be done? How about your preoperative visit? Are you going to find out about like your medications and when to stop eating and that kind of stuff?
Yeah, right. That's where you're going to learn some things about your medications. Some medications you take right up till the morning of surgery.
Right.
Some medications you have to stop the day before or a few days before. And the most common class of medications that needs to be stopped before surgery are some form of blood thinner.
Right. Okay. Why does that matter?
Because you're going to have a surgical procedure, so there's going to be bleeding. If your blood is has blood thinners on board, the bleeding may be excessive.
Right.
And if you're having a spinal anesthetic, this is probably even more important.
I would agree.
Anesthetists do not like to put a needle near your spine if you have blood thinners on board, because you could have bleeding around that area, which could cause a hematoma around your spine, which can be dangerous.
And theoretically cause nerve damage that's either temporary or permanent.
Right. So certain types of blood thinners need to be stopped a certain number of days before, and it varies from institution to institution and blood thinner to blood thinner. So you really got to pay attention to that at that pre-op visit.
And what would happen is if, say, you were told to stop your medication 3 days before, and you only stop it 2 days before, when you show up at surgery, you are likely or potentially going to be canceled because the risk is greater than the benefit, especially for a knee replacement. We've always said a knee replacement is an elective operation, something that you're choosing to have. It is not life-threatening. So to delay it in order to increase your chances of success obviously makes sense.
Okay. It may seem like it's really hard to actually get the surgery done with all these roadblocks they're throwing up. But believe me, 99% of the time it happens.
Yeah, another medication more current that is presenting some issues with anesthetic is something like Ozempic, or that class of medication where because of the delayed gastric emptying, some institutions are increasing the amount of time before surgery that you don't take it, because even if you stop eating 2 or 3 days before, they've found that some people still have stomach contents there. And why does it even matter, Paul, if something's in your stomach? You're like, I'm just hungry at 2 a.m. I want to have a snack before surgery. Why can't I do that?
Okay, that's a great question. That's going to lead into the next really, really, really important thing that you're going to do before surgery.
Okay.
You have to have an empty stomach, because if during the procedure you experience nausea and vomiting, for example, and that might happen because you're getting a lot of different medications on board. When you're heavily sedated, you can't protect your airway very well.
Okay.
All right. So if you're vomiting, if you're experiencing nausea, if some of that food comes back up, or you have some regurgitation of that food just even in your throat or mouth, and some of that food goes into your airway, that can be dangerous, because down the airways, that's sterile, right? Food's not supposed to go down there. If it does, it can lead to an abscess, an aspiration pneumonia, we call it.
Big inflammatory reaction.
Or you could just choke off your airway and suffocate. So
very dangerous.
For many reasons, whenever you undergo a surgical procedure, you have to have an empty stomach.
Yeah.
That's why you can't eat or drink anything after midnight the night before your surgery.
Agreed.
We call it NPO, which means nil par os. Did you take Latin in high school?
No, not in high school. I took it in first year university.
Really?
Yeah.
Was it hard?
It's really hard, actually. It was a bad choice. It seemed like the sensible thing to do. Bad choice.
I never took Latin.
A lot of words, a lot of vocabulary.
No, never took Latin. But I think that is where that NPO comes from.
Yeah, so nothing but, and depends on the institution. Sometimes you can have clear fluids, but obviously clarify this with your anesthetist beforehand or the preoperative clinic, because you don't want to disobey those rules and risk getting canceled.
Does anyone like speak Latin anymore? Like, do you see two people on the side of the street just chatting in Latin?
I don't think so, because there's no country called Latin.
Latin America.
Yeah, I know, but it's not a country.
Do they speak Latin there?
I don't think so.
I think you just have that. I think it's just a root of a lot of different medical words. And if you're really interested in linguistics, you might like Latin because that's how you learn where other words came from.
Maybe.
So your NPO
Okay.
at midnight, and it's really about 8 hours before your surgical procedure, before your anesthetic is instigated, that you want to have nothing in your stomach.
Okay, back to your other pre-medical history, your past medical history before surgery. I think it's really important to optimize anything that can be optimized. So, for example, if you're a diabetic, it is important to have your sugars as tightly controlled as possible, and that's always.
If you're living with diabetes.
Living with diabetes, yes. So, and that's all the time, but particularly around surgery, having elevated blood glucose increases your risk of infection. Your nutrition should be optimized. If you are protein deficient, or if you are living with protein deficiency, you should optimize your protein, because adequate protein is required to heal wounds.
Skin has to be intact.
It does have to be intact. What does that mean, skin intact?
Okay, so there's a lot of reasons your skin can not be intact. You could have a laceration, you bumped your shin on a coffee table, or you could have poor vasculature in your lower extremities and have some ulcers that are forming there.
Right.
The reason we want skin to be intact is because skin is one of the most important barriers between you and the environment. So and in the environment are bacteria. If your skin is not intact, bacteria can enter your bloodstream. If bacteria enters your bloodstream, it can seed in and around the implant that we just put in, and you can develop a PJI, a prosthetic joint infection.
Not good.
We've made videos about that.
Yep.
It's not good. It's treatable, but it's not good. And so if we can avoid that, we avoid it. So we always want skin to be intact, pretty much in your whole body,
Right.
before you have a surgical procedure that's going to end up with you receiving an implant.
Right. So we don't want an infection in your leg. And on that same note, we don't want infection anywhere else. So if you have pneumonia, this has to be optimized, and then we'll potentially delay your surgery. If you have a urinary tract infection, this has to be treated well in advance. If you have a dental abscess, and this is a really common and often sneaky one, if you have a dental abscess and are requiring surgery, that needs to be dealt with before you get your total joint replacement, because of all the things that Paul just said.
A lot of bacteria in the mouth with an abscess, a lot of bacteria in there. Bloodstream, bacteria in the bloodstream ends up on the implant.
Okay, so you're optimized medically now. What do I have to do to increase my chances of success, specifically for a knee replacement? What can I do before? What's happening before? What can I do?
I would do some prehab.
Okay, what is
that?
prehab?
That is hab that you do pre. So it's sort of some sort of physiotherapy. Really get your knee ready for surgery.
Right, improve your range as much as you can, improve the strength as much as you can, and then you learn the exercises so you know kind of what to expect.
We're talking about knee replacement here, but a lot of these are generalizable to other joint replacements as well.
100%. The other thing for me is you need to have some type of plan. So plan at your house. You need to have a plan on how to get home, a plan on where you're going to go, a plan for the setup at your house. Like, you don't need a special bed, but just your bed situation, I think, needs to be dealt with.
Yeah.
And then specific to the knee, I'd say we want to make sure that you have a plan to deal with the swelling. For me is a big thing specific to knee replacements. And I want you to have a plan on how to ice that knee, and whether that's ice packs, whether that's a bag of peas, whether that's a commercial cooling unit that have become very popular and very successful in controlling the swelling. This really increases your chance of success.
Right. If you're not a planner, and you're thinking, I'm just going to wing it, this is not the event to wing through. Okay. I'm a big fan of the chicken wing, but I would not wing it with this. Okay. We really need some kind of idea of how you're going to deal with the post-operative period.
Because we want you to kill it.
Don't wing it, kill it.
It's like kill it.
I like that.
Yeah, we want you to do well. And similar to that, as far as your plan is where you're going to go. So if you are going to go home, that's great. If you're going to have a friend come in and help you, if you're going to go to someone's house, maybe your child's house, or if you're even going to go to a rehab facility or respite care, that all needs to be arranged well in advance.
Hey, I live alone. Can I do this?
100% you can do this. Yes. You need to have a bit of a plan, but yes, you can do this.
I would say, not everyone. I mean, certain individuals might not be able to manage alone.
Right.
If you have other musculoskeletal conditions that will inhibit your mobility after, you might not be able to do it alone. If you haven't been living alone for a long time before, and you don't have a setup where people come in to help you, you might not be able to do it alone. But most of the time, for most patients, can manage it alone after. And
I'd say the last thing is like have a work plan or a return to work plan. Obviously, if you're the boss, then you need to figure out how your business is going to work. If you're an employee, you need to let them know how long you're going to be off. And usually we say, ideally take as much time as you can, up to like 3 months is what we would advise. But have a plan for that and kind of stick to it.
Yeah. Oh, yeah. Work for sure.
Yeah.
And everyone's job is different, and
Yeah.
every individual is different.
Yeah.
So there's no
Your situation is
So
different.
people often say, well, "How long will I be off work?" It's like, I don't know. It depends. What's your job?
Yeah.
Are you getting paid to be off work? Like, do you have a vacation sort of
Yes.
plan that you can
Would you
tap
have the
into?
means to be off work?
Do you have the means to be off work? If you're
Yeah.
self-employed, can you afford to be off work that long?
Yeah.
Can you modify your work? Can you work at home for a bit?
Right.
So there's no blanket answer for how long am I going to be off work.
Yeah.
It's going to be tailored to you.
Yeah.
Do I need a hospital bed?
I would say 100% no. Some people still do it, but
Yeah.
I think the regular bed is fine.
You don't need a hospital bed.
No.
I had a patient once. She had one of those beds that you can lift the legs up. And
Oh,
lift
yeah,
them.
yeah. The adjustables.
Yeah, but she got messed up and she ended up lifting the legs
Oh,
and
no.
the top, and she was in like a V format for a while. It was horrible. And then she fell out actually, and
She fell out of her bed.
she broke her hip. That's how she broke her hip,
Oh, my.
because it's got into that sort of V
It's kind
position.
of funny at the beginning, and then it got all funny very quickly.
The story took a turn.
Wow, that's horrible. So be careful with those beds.
Be careful.
Okay, now you know. We just wanted to give you kind of the landscape of what's going to happen once you're booked to the minute that you show up at the hospital. We're actually going to do a good follow-up video on exactly what happens the minute that you get to the hospital to the minute that you leave. So that'll be a nice little follow-up.
Yeah, I like that. I'm looking forward to that.
Leave comments about your pre-operative experience. And if you like this video, please like it, subscribe to our channel.
We might have missed something. You know, it's possible because
Yes.
we're not patients. We're seeing it from one side. So you guys are seeing it from the patient side. So definitely leave a comment about, oh yeah, don't forget, we have to do this. Don't forget, you have to pack your toothbrush. There's a million things, little things that people who've been through this will know that we haven't. So please share that in the comments. And remember, you are in charge of your own health.
See you next time.